All right, I think we'll go ahead and get started. Thank you everyone for hopping on this morning, a Monday morning. So most of you probably have been at it pretty early. Hope you're already on your break. But we thank you for joining us today. So don't forget to put your name, full name, and your facility name into the chat box. I'd like to introduce anybody from DHHS if they're on. Please introduce yourselves.
Good morning. This is Z Winfrey of DHHS Preparedness.
Excellent. Thank you, Siddhartha. Glad you're here. Sadie, are you on?
Hi, sorry, yes, I am. This is Sadie Opegard. I am the Epi Surveillance Coordinator for the Foodborne Enteric Program, and I am on.
Great. Do you have anything you'd like to share with us today? We'll put you on the agenda right away.
Sure. So Cyclospora, we did have earlier in the summer a multi-state outbreak linked to bagged salad mixes. And while that's definitely slowed down, we're starting to see more cyclo cases come in. So if you do see those at your labs, please remember to forward those to NPHL. We also have an outbreak of Salmonella Newport that's still going on. So please just remember to forward your specimens to NPHL.
And for those laboratories who actually send their specimens, say, to an out of the state reference laboratory, LabCorp, please, if you see a positive come through, it would be nice to know that so we can contact them, or if you have the time to contact them to save the specimen or the isolate, that they could forward it to us. We actually provide boxes for some of those laboratories to send them back to us, and would like to make sure that they stay on track with our state regulations. All right, thank you, Sadie. Anybody else from DHHS?
Good morning, this is Obed. I'm the Public Health Informatics Coordinator, and I'm on.
Awesome, thank you. Much appreciate you being on, because we don't talk much about IT, but we would always like your input. When something goes wrong, of course, we're looking you up, of course.
It's my pleasure. Thank you for having me.
Yes. Is Ishrat on? Just thought I'd try one more time. The reason I ask, I wanted to introduce you to Ishrat and Margaret. As you know, Dr. Tierney did leave our DHHS program. She is now with Creighton Health, but we truly miss her, but we do have a great replacement. If you have any questions about any of our healthcare associated infections, please, especially the CREs, the staffs, any of those, feel free to give Ishrat a call. Of course, Margaret Drake is our backup, and that is another link that you can call as well. And we'll make sure and get those changes made to our website so that these are on our contacts page on the nphl.org website. Okay. Going on, I would like to open up the main topics and discuss a little bit more about outbreak testing, which NPHL is really leaning toward. I think that it's great to say NPHL is on track as far as turnaround time. Once we receive the specimen, we can turn it around within 24 hours. So that's important to know for our outbreak situations, and we would like to be there for you just in those situations. And John, if you're on, would you be willing to share anything along those lines? How do we know it's an outbreak situation?
At the moment, the outbreak potentials, outbreak situations that we're going to be working with the local health departments on are largely left up to the health departments, and I'm trying to just supply them with kits so that they can, you know, have this rapid or relatively rapid turnaround times for these opportunities. By and large, we're looking for, you know, maybe half a dozen specimens or so from a given school. Again, we have turnarounds of normally about 24 hours once the specimens are in the lab. And then once an outbreak has been detected, I'll be working with Z and the health department to help the community, help the school do larger mass surveillance testing once we've got confirmation.
That's good to know, John. Thank you. And when you say that you are sharing kits that can be readily accessed, where would that be with the local health department?
At this point, I'm leaning towards having these kits available at the health department initially. I know in some of our rural areas it makes more sense because the sparseness of the population, it can make more sense to have kits available at local providers. I'm more than happy to help with that. But as much as possible, I'm trying to put as much power into the local health department's hands as possible to get the kits where they need as quickly as possible.
Okay. Robin, I see you're on. I'm glad you are. Would you be willing to share any other information on outbreak situations?
Yeah, so that's just what John said. MPHL will be able to just help with identifying outbreak situations, and then any further testing should be done through Test Nebraska. So single cases, not long-term care facilities per se all the time. Certain circumstances, correctional facilities, group homes, and schools, you know, those outbreak identification, and then we move on from there for additional mass testing. So we'll be able to, MPHL will be able to provide that for you. If you have any questions, please just contact either me or John, and we can help you out with any questions you might have. But typically the local health departments will have these collection kits on hand for use for that purpose. Yeah, so any other questions about that? There will be, Karen should be releasing an alert today with that information in it. There will not be an official HON coming out with it, so just please refer to the document that Karen will send out to you.
I do hope I can get it out today, certainly. But this is just a review of what we've had in the past on our criteria for sending specimens to NPHL. These have not changed. We have added situations of school or daycare outbreaks. Again, as Robin said, the 1s or 2s, up to 5 specimens, of course. If you feel strongly that these need to be tested immediately, that is what NPHL's goal is. Again, we do not accept all the pre-surgicals, dialysis patients, OBs, any type of surveillance test. That does need to go to Test Nebraska. And Pete, I don't know if you have anything further to add there too.
Well, Karen, I think you've covered it, or John and Robin, you've covered it pretty well. The key for us is that if you want rapid turnaround time, we hope to provide that through the public health lab for stamping out these outbreaks as quick as we can. And that includes schools as well. We know there's been a lot of positive cases showing up in the schools, and I'm not sure where this testing is taking place. We don't think much of it's being done at the public health lab at the moment. Our volumes are down considerably from where they were, but we have increased the capacity to do a lot more testing. So we're available to do testing if it needs to be done. And I'm sure that Emily will talk more about it when she gives an update with the lab status, but that's where we're at.
Awesome. Thank you. And Pete is correct compared to, say, even a month ago or 2 weeks ago, where we were a lot more inundated, but we have worked hard to bring up our numbers, and they have been successful. So we're happy to say that a majority of the time, turnaround time, again, it's how you define turnaround time, but from the time we receive it, it is 24 hours. I do realize that transport is an issue sometimes, so we can also help with that if there are questions. So I'd like to open it up to questions now, and I do think if you have any questions, please unmute. I do have one question here. It says, are Test Nebraska events having the same turnaround time? Not sure who can answer that. I am not aware of their times. Robin?
But John has that information as well.
Their turnaround time is about 3 to 4 days at this time.
And Tony did have a good reminder, even though we talk about turnaround time. Yes, the fact though is we are not staffed on the weekends. That is a lot of overtime, and right now the funding's not there. So we do not test on Saturdays and Sundays. We do hope that any specimens that will be tested on Friday, that they are received into our laboratory by 11 a.m. and we can get it on that final run. Otherwise, thank you for the reminder that weekends, this does not count for the weekends because we cannot staff on weekends. So.
But Karen, if there really is a need on a weekend to get a test done, we can work with Nebraska Medicine, who's staffed 24/7 to get a test run.
Thank you.
There are ways to get a test run if there's a real need to get it done.
So if that does happen, do they call their local health department, which I think we have discontinued quite a while ago? Do they call us? How does that work on weekends? Just page our 24/7 number, I assume.
I would assume that's true. Emily, your thoughts on that?
I would suggest that the facility needing the urgent testing needs to be working with their local health department, who will then be in contact with the state. Once it's approved by either the local health department or the state as a stat test, then at that time, go ahead and contact the 24/7 pager. But once we need that approval for stat testing first.
All right. I think it would be worth calling your local health department. Make sure that you know who that is. If you don't, I'd be happy to share the list or the link for you. But I suspect that most of you by now do know who that might be. All right. Thank you, Emily and Pete and Robin and John, for sharing that information. All right. So we hope to get that alert out. The next thing I thought I would do is, rather than, I'm going to skip over antigen testing and speak, since Emily and Pete are on. Do you have anything further that you would like to add? I would open it up to any questions too for Emily and Pete. Go ahead, Emily, I'm sorry.
Yeah, okay. We are down in volume, as everyone said, for the testing for COVID, but we are also fully prepared to help support any school outbreaks that are coming up. I think everyone in the state kind of is just waiting for that to begin happening. So we, of course, are more than prepared to offer a quick turnaround time on that testing. As Sadie indicated earlier, we're working with at least one Cyclospora outbreak currently. We are up to date on all of our Cryptosporidium testing. We've dealt with a couple norovirus outbreaks, and we are also working on 2 Salmonella outbreaks as well, with the potential of a third coming up. We just did some whole genome sequencing on Friday and analyzing that today to see if we have any specimens associated with that new outbreak, which if you saw it on the NPHL Facebook page, that is associated with peaches bought at Aldi. So we've been still very busy in the lab with our focus. Kind of nice to be shifted away from COVID for a little while, and be able to focus on the other things that are important in the state of Nebraska. I would like to take this opportunity to just remind submitting facilities that Nebraska Public Health Lab and Test Nebraska are 2 separate entities, and unfortunately you cannot send specimen collection kits from one to the other and vice versa. And that also goes with the ordering systems. I just wanted to put that out there. I know we've had some issues with this in the past couple months, and it does become cumbersome and obviously delays turnaround time on those test results. So if you have any questions about it, please feel free to call us, and we're happy to walk you through that process.
Emily, do you want to share a little more on the coming flu season, what our plans are for influenza, or what we're at least talking about?
Robin and I are probably going to have a conversation about that soon so that we can get everything more concrete as to what the plan will be going forward, and then I think we'll share it with everyone. But just to let everyone know, the CDC has released a multiplex assay which will allow for detection of both flu and COVID at the same time. We do not know what the supply chain is going to look like for that assay at this time, so we don't want to put all of our eggs in that basket, but it is something that is currently available. So Robin and I are going to meet to discuss how to utilize that for the upcoming flu season.
Great.
Great. Yeah. And Emily, thank you for that reminder about swabs are very specific to the laboratories, as well as the computer systems. So if these specimens are going to say NPHL, don't enter them into, or don't use the swabs for Test Nebraska, and use their computer system, and vice versa. So be very specific, and really, if there are any doubts whatsoever, you've got to call and ask questions. It will save you a lot of time in the long run. So I'm really glad you mentioned that, Emily. Thank you to both of you for those updates.
Karen, I'd like to share one more thing about the upcoming flu season. I'm on a national task force discussing nationally what's going to be done when we get into flu season with the CDC. And there's still a lot of questions coming down from them as well. And I was told that they plan to put out some guidance. When I say they, it's the CDC plans to put out some guidance here within the next week or to 10 days on what the expectations are for flu testing along with COVID testing. So I guess stay tuned and see what they come up with. I know there's a lot of issues about supply and supply chains and being able to do dual testing. So that's a big topic of discussion. So we'll see where it all goes.
Yes. Could we be so lucky, say, for instance, in the Southern Hemisphere, we have heard that influenza is non-existent. Is that true, Pete?
Well, I don't think it's non-existent, but I think it's down compared to what expectations are.
Certainly.
I don't know if that's going to be true in the Northern Hemisphere. You know, we just don't know what's going to happen. But
Well, Pete, I'd like to just kind of put a caveat on that too. The amount of laboratory detected cases is down, but they do not know if that is truly because the prevalence of flu is down in the Southern Hemisphere or solely because people are trying to quarantine and avoid the doctor's office. So the amount of actual testing being performed is down.
I believe that true. And also, I do not think that they've had near as much coronavirus down in the Southern Hemisphere. So like you say, they're quarantining themselves to just try to stay safe.
Yes, that's true. A lot goes into play there. So thank you for that information. Siddhartha did comment just real quickly that at this moment, the turnaround time is 53 hours there at Test, Nebraska. Go ahead. Did I hear a question? Or
Oh no, this is Robin. I was just going to transition to, you know, the test while we're talking about the testing.
Mhm.
And I don't know if you were going to kind of go back to the antigen testing, or
I will. I will.
can I stop? Okay.
Yeah, I do plan on that. There's a whole section I'd like to just kind of share. And if there are no more questions on the laboratory status, I certainly can go on to that. Okay, hearing none, I do want to go back to antigen testing. I don't know if Dr. Safranek is on, but he did share some really good information this week with us. Let me start with this. There, of course, is a link to the CDC information about antigen testing. I have listed there. There's a really interesting YouTube. I'm going to try to bring it up. I'll only play a minute of it, but don't think that it's just a summary. They go into a lot of detail. I will not play the whole thing, but I love their analogy to a coffee scenario. So let me see if I can't bring that up. I believe I've got it over here. Here we go.
So I think of rapid daily tests in two camps. So you have the Nespresso camp, and these are going to be machines that you have to go out and buy, and you have to buy capsules that are proprietary to that instrument. And yeah, they could probably be connected to the web, and but they're a big machine, and that is immediately going to limit its distribution and utility. But it will probably do the job and do a really good job, relatively speaking. But what I really want to see for these tests is not an espresso model. That's good if we get them cheap, but I just don't believe we can get them cheap and distributed in the tens or hundreds of millions. I want the instant coffee version that every single person around the world can easily get. That there's no frills, they're not connected to the internet, there's no buttons. It's just, but it does the job. And the job in this case is to tell you if you're detected as positive. And so both of these things can exist today, but the FDA is really pushing for this model over here, the Nespresso model.
I love that coffee analogy because the cheap coffee still has plenty of caffeine in it. It still does its job.
So what I'm trying to say is that we ask a lot of questions about antibody and antigen testing. I know if you saw the note underneath it, there are none of the antigen testing, I think, that truly have, good FDA approval. Some do very rarely, but there's a lot of argument out there. But right now, really, the only good testing that we have currently is the PCR testing, and that is a, it's hard to get that test out. We realize that, but until the antigen testing can come up, which a lot of people do feel as these articles do have, that they'll be helpful in the future, but there's a lot of work that'll need to go into it. Dr. Safranek also shared a number of articles with us, one coming from the Atlantic that was quite interesting about antigen testing. And I believe also a good reminder that there are problems with antigen testing, and we do have to play those in mind too, or keep those in mind when we're thinking about antigen testing.
So I think of rapid
That's
daily
not what I
tests.
wanted. I'm sorry. So those are just some of the things that I know Dr. Safranek had shared with us here about a week ago. So I will share these with you in an email going out if you're interested in looking up any of these topics right now. Pete, is there any antibody testing available now that you would recommend?
Karen, that's a loaded question.
Sorry about that.
Interpretation of antibody testing is still being discussed, but I will say that antibody testing is available through our regional path services here at the Nebraska Medicine. So there is testing available. I think it's being used more for surveillance to find out how much infection showed up in a population. We do not offer antibody testing at the public health lab at this time. We are waiting for more guidance from the CDC on when it's appropriate to do this type of testing. So I think the jury's still out on how good is it and whether and where it should be used.
Exactly. So very good point. Thank you for that, Pete, that information. I think these particular links do a great job of explaining the differences, the pros and the cons of each. So in your spare time, good reading.
Keep in mind that antibody testing is not for diagnostics.
Right.
While antigen testing can be used for diagnostics. So there's a big difference between the two.
Good point. Any questions on antigen testing? Robin?
Yes, I have some additional information. So Obed is on the phone, but I'll start the conversation and he can add to it. Reporting of antigen tests, COVID antigen tests. All COVID tests are reportable, positive and negative per HHS, and we do have a document that will be signed by Dr. Antone stating this. So each one of these will be needed to be reported individually, whether it's PCR, antibody, or antigen. So we are putting together a system that you can upload or give us that information rather than sending individual lab reports. And we will be in contact with those who are performing the antigen tests. If you are not doing electronic lab reporting, if you are doing electronic lab reporting, you need to make sure that your filters are updated so that all of that information is being sent to us and getting into our system. If you are not doing electronic lab reporting, you must report it via the system we are putting together. Hopefully we can get that information out to you guys this week. We'll also, so I just want to let you know that it is reportable. You have to report them, positive and negative, individually. So please start trying to make a plan to do this. If you start bringing the rapid antigen tests on board, we're planning on doing like a CSV, Excel template type of situation that we will provide to you, and you can pull out those data elements from your system somehow and get that information to us. So we are providing you the templates and what you need to send to us. Hopefully that will be out this week or, you know, as soon as possible. Obed, do you have anything to add to that?
Yes, Robin, you're right. So like she said, hopefully this week we should be able to send out some communication in regard of the recent update to meet HHS and DS and CDC's new regulation on COVID-19 reporting. So we are almost done with those documents, and Connie, our manager, should be sending out some email to everybody in Nebraska about the new guidelines on the reporting. So yes, that's it, Robin. Thank you.
I also wanted to say that if you know of clinics that are performing the rapid antigen test, those are also reportable from them. So this isn't like flu. Everything is reportable for COVID. Each test that is being done. So
Okay, thank you, Robin.
tell your friends.
Yeah, for sure. Got a couple of good questions for you. Stephanie wants to know, is there a certain form that needs to be faxed to report these, especially for laboratories who are not able to do it via electronic method?
Yes, we'll have a template that you can fill out and send to us. We're going to try to have it be as electronic as possible. So fill it out on your computer and then upload it to our system so that it goes into our database, so we don't have to data entry all of these into our system. As you can imagine, the entering all of these lab reports into a system is really time consuming, and we had to develop an electronic upload system so that we could take down the time that manual lab entry is taking us. So you'll get all those documents, and as soon as you get them, please feel free to give feedback and provide us with helping us to improve the system, because this has to be easy for the laboratories to use.
Yes,
so definitely need your feedback.
Yes, Robin, you're right. So I will confirm that hopefully by Friday at the latest, they should all be out your way to kind of review them and give us feedback. We're all ready to send them out. We're waiting for final finalization now to make sure it's ready to go.
And the second question about how the patient's information being used by public health, the negatives, we use this to determine percent positivity. So this allows us to see how many people are actually being tested, and of those, how many of them are positive. That does help us to determine the severity of if a whole bunch of people are getting tested for COVID, maybe they need to be tested for flu instead, and they're coming back negative. And when the flu season does come up, we have to have people think of flu as well. We do have other coronaviruses that circulate as well, so, and lots of other respiratory diseases. And so, I know COVID is super important right now, but there are 16 other respiratory diseases that are out there that are important to watch out for as well.
And certainly, that was an excellent question, Jessie. One suggestion she has is it possible that to report the negative, but not necessarily without a name or address, that might help in relieving the laboratory of some of its work, but that's a suggestion. Another question we have from Christy is, how's the percentage positive being shared?
That information is on our dashboard. That update has been put there. And also hope to have more of a combined respiratory epi report, like I do with the flu report, but COVID-wise. Probably should have been doing that a lot longer, but the dashboard kind of took precedence. So hope to get some more data analysis out there for you to see what is happening in the lab world with COVID. And we are looking at the potential, just reporting number of negatives like you do with the flu information. I have brought that up, and you know that might be a potential option. We just have to, since unfortunately HHS has said that positive, each test has to be reported with all of those variables. And so that's kind of how it has to be. But in the interim, we might try to figure out a way for you to report just negatives. We're still working on that part. So
Certainly. I did skip another question here, not intentionally, but Gerald does have a question regarding do we pull these forms from NPHL website? I can post them there too. I'll also post the link to the DHHS website that has all that information. So I'll try to get that this week once they have submitted everything. And then he comments that they're using the HHS 10 DC form right now. Is that sufficient, Robin?
yeah, what you're using right now to report is fine, but we will need you to utilize this new template so it can be electronically uploaded. The forms that you're submitting via fax right now are all being manually data entered, and we need to revise that process because there's the reason we don't report every single influenza because there is way too much data entry. So we're trying to get as electronic as possible.
Say, Robin, this is Pete. I have a couple questions about reporting and testing both. But first off, is my understanding that the antigen testing, the antigen instruments are going to be placed in nursing homes. Is that what you're understanding as well?
In some nursing homes, the CMS made had some sort of calculation on where they're going to place these instruments in nursing homes. So nursing homes will be doing these tests, and
so that's going to be an issue about reporting for them.
Well, they will be reporting the same way as any other laboratory, and
right, but they're not
we definitely need to.
They're not
I
laboratories, so it's going to be a learning process for them.
Right, and we definitely need to contact you guys about potentially helping with training, etc.
Well, the other issue is putting these in nursing homes. And Tony Goldenstein, maybe you can share more about point of care testing that I'm not familiar with, but it is in my mind that these are considered waived point of care tests, these antigen tests, but they still require that the tester have a certificate, a CLIA certificate of waiver. I'm wondering how many of these nursing homes are going to have a CLIA certificate of waiver to be able to run these tests. Tony, are you on, Goldenstein?
I did not.
What's that?
Tony's on another meeting. This is Brian.
Okay, Brian, do you understand the issue?
That is correct. You need a certificate of CLIA certificate to do perform wave testing. There's probably several people that can confirm that on this call.
Okay, I'm going to check with Becky Wiesel on that issue and to confirm that situation and make sure that we're all good there. Thank you for bringing that up.
And my last question, Robin, might be, at what point is confirmatory testing going to be done? Because we know that the performance, the accuracy of these tests are not as nearly as good as the gold standard PCR testing. So we may want to have some information on when additional testing might be considered.
Again, I believe there is guidance on how to utilize these tests provided by CMS, and they will have to follow those rules on how to do further testing at the nursing homes. So definitely need to look at that guidance. I don't know right off the bat specifically for them, but they all have to follow what's going out from CMS.
We need to make sure that that is clear and make sure that we know who is going to be their confirmatory testing site.
You know, this could be a good, this is Karen, could be a good topic for a future call, certainly. So I know that you're still working on a lot, Robin, so there's a couple things there too to think of. I have an interesting question from Corliss. She says that she does report daily to FEMA their positives and negatives on their PCR platform. So is this, FEMA's different, isn't it? So we're going to be asking them to also report to DHHS, correct?
Well, that's another thing I had to ask, as I was under the assumption that reporting to us and then we were providing that information to FEMA. So there was not, laboratories did not have to provide that information duplicatively.
Twice. Yeah.
So, you know, let me look into that to make sure that that is the case, and I can get back to you on that one.
Okay, I realize that. So again, I think it might be a great topic for a future meeting. Cheryl had, I'm sorry, Kay, you had a comment that Cheryl is working, who's their laboratory director, getting another CLIA certificate for their nursing homes attached to the hospital. And she said her understanding is only homes attached to hospitals are required to have that CLIA test. So something definitely to look into, per se. And then I know Christy Nichols has, there is a waiver right now that allows established laboratories to oversee the COVID testing in another location under their own CLIA certificate. So that would make perfect sense. So some things to think, keep in mind. There's still probably a lot of questions out there. There are a couple of comments too about why can't, you know, if they could just report the number of negatives along with complete information of positives. So lots of good things for Robin to work on. So we'll keep in touch. We'll get that information out to you as timely as we can. So any other questions? And I'll again go ahead and open up the mic. So if anybody has questions about any topic, we're willing to bring it up. And I'd like to throw out that if you have any other suggestions of topics, I'm always looking for interesting things I can put on the agenda. So please let me know. If not here, it may be in an email. So any final questions or comments?
Karen, this is Christy Nickel. We actually went live with the antigen test in our ED this morning, and we've left it up to the providers to make that decision. If they're low risk and they're just trying to get their negative, go back to work, that's what they're primarily going to use it for. However, if they have any that they question that come up negative, we're going to let them order that PCR test. More of a tool to help us preserve our test materials for PCR testing for patients who we really need it for. But just a question, wondering how that would be counted. If we have a patient in the ER that we do the antigen test on, it comes up negative, but they're questioning it, so we do the PCR and that comes up positive. Will both of those be counted, or will they count that as a positive? I mean, just kind of curious about that.
How should laboratories handle such a discretion?
Well, it sounds like we have to report both of them, but I'm wondering statistics-wise, how will that be counted?
Yeah.
Right. So yes, you do have to report them all. We do have a process that reports it by person. And then we also have a process that counts number of tests performed. So they each have their own uses. And so we only count like the first positive of a person who has been tested. And then if it is positive and PCR negative, I guess we'll have to figure that out later. That's something that, you know,
But we're
that's
not,
something we have to do with flu as well.
yeah, we're not going to repeat it. If it comes up positive on our antigen test, they're being considered positive. We're not going to do a PCR test after that.
Okay, thank you.
Yes.
It'll cuss. Right, so.
That makes sense. And from Z, she did share that Becky Weisel said that a CLIA certificate is required. It is one of the criteria that CMS uses to determine which facilities have received the equipment. So she says it's our belief that facilities scheduled to get the machines will have this on file. So it sounds like that may be built in already with these systems, so that's good to know. We do have another question from Amber. If our nursing home is attached to our hospital, could the testing that is going to be given out be given to us so testing would be done by qualified personnel? That makes sense, but I'm sure, again, there's pros and cons. Any other comments?
If you are the ones that were going to receive the equipment, you would have already been notified. So I believe that's all that is going out at this time. So you need to speak with the CMS representatives or Becky Weisel about that.
I believe that, Robin, but there are going to be facilities who are going to get these instruments outside of CMS. So they're going to have them in facilities, and they need to be aware of this CLIA waiver.
Okay.
We had the same issue with the ID Now kits that went out, making sure that they went to facilities that had a certificate of waiver to use that test.
Yeah, and Dustin Z had sent a list of all the facilities that were getting these to the local health department directors. So Paulette, I think just get in touch with Kim. She'll let you know where they are.
Thank you.
All right. Any other questions? Okay. Thank you for a great discussion. Again, don't forget to sign your name if you have not yet into the chat box. I do want to say that we have been considering doing biweekly or twice a month until through August, but that time is here. So I want to know what your comments are in regards to just going to once a month, if that's sufficient for you all. And if we can, we will start our meeting our next meeting would only be 2 weeks. And then after that, we would hold that we could only meet on a monthly basis. I like that idea better than the original quarterly. I think there was just so much to speak to on our quarterly meetings. I do plan on keeping it as a monthly. Laboratory has much to concern themselves with. So I think shorter meetings on a monthly basis is much better than quarterly, really long meetings. So as far as future trainings, RBT Online classes are available. Let me see, I had them posted at one time here. Well, they are on the NPHL site, but you will have to go to the training page, and they are there. What I'm trying to do right now is get and it's been hard, to get our handouts listed on the site as well. Encourage those who have already started this program but haven't finished all 3 to go ahead and get those watched. And then they have to email me for the code in order to get your CEU approved. So please let me know if you've watched all 3. I need that clarification or that documentation. We'll go from there. Gerald does have one other comment. He says, I would assume that if they're performing the DIP-UA and whole blood glucose, that they would require CLIA waived regardless of affiliation with the hospital. CLIA are based on physical address. So that's a very good comment there. And suspect that there are quite a few sites that currently are doing the wave testing. So this would again require that licensing or that certificate. The only other training I have is if you have anybody in your facility that they're